So actually, we have used it so far in a study, but we have done quite a lot of cases. So first of all, I think it's really a very bright idea to use something completely different principle to find orifice arteries by blood flow changes. So that makes it really very attractive, I would say. And our experience, we have used it in aneurysms to find renals, to know exactly where we have to start with our EVAR cases, or also to mark renals, mesenteric artery, celiac trunk, to mark them with wires potentially in difficult fenestrated grafts, so to reduce contrast and fluor. So I think it's really a very smart idea, and I think it really has a potential to help us. So first of all, there's one very clear patient group. These are the patients with renal dysfunction. They really don't want to spend a lot of contrast medium while you're searching for your viscerals, renal arteries. So there you take that device, you take your wires in just without fluoro, without contrast medium, and you very precisely know where to land your graft. And second is, of course, difficult anatomies, because difficult anatomies you very often have to change C-arm position to find the correct one, to see find your visceral arteries easily. And this one device just really helps you to avoid a lot of C-arm positions, which are really not very nice for the interventionist, which means a high radiation load for you. Of course, I mean, the alternatives would be fusion CT, which you may like or may not like so much. That could be, of course, an alternative. Others, for example, in patients with renal dysfunction, could be, of course, CO2 angiography. However, that again is an even higher radiation dose for the interventionist and also for the patient. And there are situations where CO2 does not really help, although, I mean, of course, in renal dysfunction patients, it's the way to go. So renals are going horizontal. CO2 may not really reach the renals if you inject it into the aorta. And very difficult is, of course, also the hypergastric artery, because it goes dorsal and CO2 always goes upwards. So there, for example, this to measure the flow velocity and by that find the hypergastric is a very nice idea.